Hello everyone. So what are the requirements for the junior student on the internal medicine clerkship? In this video I will talk about clerkship requirements in 4 parts. Number 1. Required clerkship cases. Each student should be assigned up to 1 to 3 patients with different problems. Student must see a patient with each of the following 14 conditions and perform workups over 7 weeks. These 14 conditions ensure students see patients with different chronicity, symptom, organ dysfunction, and situations. Acute medical illness, like acute pancreatitis, cellulitis, and acute GI bleeding. Worsening of chronic medical problem, example, COPD exacerbation, acute on chronic CHF. Patient with multiple medical problems. Patient admitted because of lack of access to primary care, social issue. For example, frequent COPD exacerbation patient doesn't have electricity to run O2 tank or nebulizer. Abdominal pain, example, pancreatitis and spontaneous bacterial peritonitis. Chest pain, which could be cardiac like MI, pericarditis, or pulmonary like pulmonary embolism. Shortness of breath, which can be cardiac, pulmonary, or anemia. Metabolic problem, for example, thyroid, hyperparathyroidism, and diabetes mellitus. Liver disease, like hepatitis or cirrhosis. Kidney disease, like acute kidney injury, CKD, glomerulonephritis. Fever, which could be due to infection or medication induced. HIV/AIDS. This does not need to be the primary reason for admission. In fact, for those need to be the primary, you just need to also providing care for this problem. Altered mental status, like delirium, dementia, and medications. Geriatric syndrome, falls, incontinence, and memory problems. Not only it is important for the students to see the cases that we mentioned, but they should also learn how to perform the following clinical skills. To obtain medical history and perform physical exam appropriately detailed, accurate, and efficient. Compose accurate, complete, well-organized notes, HMPs, progress note, discharge summaries. Interpret diagnostic test results and determine how the results should influence patient evaluation and management, and that include metabolic profile, ABGs, CBCs, liver tests, basic EKG interpretation of the rate, rhythm, axis, interval, basic chest X-ray interpretation. Students have to develop differential diagnosis that is rank ordered and supported by clinical and diagnostic studies. Then develop diagnostic workup that incorporate probability-based thinking. Once diagnostic workup and differential diagnosis completed, student expected to formulate therapeutic plan that incorporates evidence-based medicine and patient preferences. And finally, deliver accurate and organized oral presentation by practicing the presentation with the intern. Interns and attendings should watch their student perform these 3 physical examinations and sign off they did. Full cardiac exam, pulmonary exam, and abdominal exam. Student assignments. Students have a lot of assignments to do. Most are patient-based, but some are not. Number 1. Patient-based assignment, and it includes medication reconciliation, pain management assignment, substance withdrawal assignment, observe sign-in and sign-out, compose patient sign-out, post-discharge phone call, high-value care assignment, and near-miss adverse event report. Number 2 are non-patient based assignment. Number 3, professional development assignment. And number 4 are extra credit assignment. More detail about them is mentioned in the student card.